This video will show you how to add an ICU admission for the APD. We have our patient Sally Smith. Click the plus symbol to add an ICU admission. Add ICU admission details starting with the date. Select the care unit. Select the admission source. The elective surgery field is only enabled when admission source is OT or other hospital. Note, the field refers to whether the surgery was elective rather than the admission. The planned admission looks at the admission itself. Was this admission planned? This could be an admission planned after surgery or a planned transfer from another ICU. The field treatment goals for admission is now more important, and this field controls inclusion in ANSROD. Respiratory arrest will be removed in the next release of COMET. Fields marked with an asterisk are mandatory. Note, pregnancy status is only mandatory for female patients. Save the page with or without discharge details. For this patient, we have discharge details, so we will add them now. The discharge date must come after the discharge decision date. The vital status field is mapped from destination on discharge. Save the page and click the next tab, Diagnosis. Select a diagnosis. Keep in mind the ICU source selected on the previous page. If source is OT, then a post-op diagnosis needs to be selected. And if ICU source is ward or ED, a non-op diagnosis must be selected. Please check the data dictionary for new rules around people who suffer a complication prior to starting surgery. Save and click the next tab, Interventions. The top section, the intervention and outcome indicators, are new. The data entered here is part of the APD dataset. Check the data dictionary for definitions. Save this section before moving on to the intervention episodes. To add a new episode intervention, click plus New Record. Within the intervention list, the fields marked with an asterisk come through to either APD or ANSPIC registry. The APD only receives data on invasive and non-invasive ventilation. For details about selecting the intervention list and using custom fields, please refer to the additional video. Click Save. The episode now appears in the grid with details such as the duration of the episode. Click back to Admission to return to the admission tree. Here, the admission tree is used to navigate to other pages. Click here to edit the current ICU admission. Click here to add an ICU care period, which we'll go through in the next video. Click here to delete the current ICU admission. And up here it's the hospital admission, so we can edit the hospital admission and delete the hospital admission. Thank you for watching. The next video in the series is the APD ICU care period.